Have you ever had an itch that just wouldn't go away? No rash, no dryness, and no clear reason? Most of us brush off these little irritations as nothing. But what if your body was trying to tell you something? Here at Golden Minds, we believe that health awareness starts with the smallest signals, especially as we age. And today's video is one that could truly change how you think about something as simple as an itch. Did you know that persistent itching in certain areas of the body has been linked to early signs of cancer, sometimes long before more obvious symptoms appear? That's not to scare you. It's to help you listen to your body with clarity and confidence. In this video, we're going to explore 5 specific itchy spots that doctors have seen again and again in patients who were later diagnosed with serious conditions like lymphoma, pancreatic cancer, leukemia, and more. These aren't random itches. They're early whispers from the body, often overlooked, but potentially life-saving. We'll explain why these areas matter, how to tell the difference between common irritation and something deeper, and what to do next if one of these signs sounds familiar. So don't ignore what your skin is trying to tell you. If you're new to Golden Minds, please subscribe, turn on the bell, and leave a comment if any of these signs resonate with you. Let's dive in, because the more you know, the stronger you become. Sign 1. Persistent itching between the shoulder blades. A signal from within. Now that you know how an itch might be more than skin deep, let's begin with one of the most overlooked, but potentially important areas, between the shoulder blades. It's easy to ignore this spot. It's hard to reach, often chalked up to dry air, a rough tag on a shirt, or even an old mattress. But when that itch becomes persistent, deep, and unrelenting, especially in the upper back, it's time to pay closer attention, because in some cases, this specific symptom has been linked to early pancreatic cancer. I know that may sound surprising. After all, how could something going on in your digestive organs show up on your back? But here's what many people don't realize. When tumors begin growing near the pancreas, especially around the head of the gland, they can press against or block the bile ducts. These tiny tubes are responsible for moving bile from the liver to the intestines. When that flow is disrupted, bile salts can build up in the bloodstream. And one of the earliest effects? A strange crawling itch deep beneath the skin, often in the back, where a dense network of sensory nerves live. Let me share a story. Marlene, age 71, started waking up with an itch in the middle of her upper back. It felt like it was coming from inside me, she said. No rash, no bug bites, no new detergent. She tried different lotions, got a new pillow, even changed her laundry soap, but the itching stayed. Only later, after routine blood work for fatigue, did her doctor notice elevated liver enzymes. A scan revealed a small tumor near her pancreas, pressing against the bile duct. That back itch? It was her body's first and only warning. This isn't about creating fear. Most back itches are innocent, but the kind we're talking about here is localized, doesn't move around, and doesn't respond to surface treatments like moisturizers or anti-itch creams. It often feels internal, like a phantom itch, and is worse at night or after eating. If that sounds familiar to you, or if you also notice other quiet signs like unexplained fatigue, darker urine, pale stools, or mild digestive discomfort, it's worth mentioning to your doctor. These clues, when viewed together, can help your provider decide if more testing is needed. And here's a gentle reminder. You're not being dramatic for paying attention to your body. The back may seem like a strange place for a warning to show up, but our nervous system is deeply interconnected. Sometimes the signal shows up far from the source. So if your back keeps whispering in the same spot again and again, don't ignore it. It might just be your body trying to speak before the problem becomes louder and harder to fix. Early attention could make all the difference. Sign 2, itchy scalp without flakes. When your head sends the first signal. Let's move from your back to another place we often overlook, your scalp. For many older adults, an itchy head seems like no big deal. Maybe it's the shampoo, the dry air, or just part of getting older. But when the itch won't go away, even when you've tried switching products, adding moisturizers, or ruling out dandruff, it's time to pause and look a little deeper, because in some cases, a persistent, flake-free, itchy scalp can be an early warning sign of leukemia or even skin cancer developing on the scalp itself. What makes this kind of itch different is how it behaves. It often feels tingly, burning, or almost like something is crawling under the skin. And yet there's usually nothing visible. No redness, no flaking, no irritation you can see in the mirror. It's just there. Quiet, annoying, and hard to explain. This is because certain blood cancers, like leukemia, can trigger unusual immune responses in the body. The inflammation and chemical changes that occur as white blood cells multiply can irritate nerves in the skin, especially in sensitive areas like the scalp. Even though there's no obvious rash, your body is trying to tell you something's out of balance. I remember Helen, 74, a retired librarian who said the top of her head began itching every afternoon. She thought maybe it was her hat or the change in weather. She tried gentle shampoos and scalp oils. Nothing worked. The sensation was strange, like a light burn that kept moving. When she went in for a routine checkup, her doctor ran a full blood panel. Her white blood cell count was unusually high. After further tests, she was diagnosed with early-stage chronic lymphocytic leukemia. That itch? It was her body's first and only clue. Another important note, the scalp is often missed during regular skin checks, especially if your hair is thinning. Small precancerous or cancerous spots can form and be hidden beneath hair. Sometimes they show up as rough, raised patches that itch, but not always. For that reason, if the same spot keeps bothering you for weeks on end and you can't find a cause, ask someone to take a look, a partner, caregiver, or even your hairdresser. And here's a helpful tip. If the itch stays in one area, especially where the skin feels different to the touch, thicker, bumpier, or slightly discolored, get it checked by a dermatologist. You don't need a visible wound or sore to raise concern. Sometimes the skin's only message is the way it feels. The truth is, your scalp may be one of the few places where cancer tries to whisper early, through nerve sensitivity rather than pain. And just because it's not dramatic doesn't mean it's not important. So if your head keeps itching and nothing helps, don't ignore it. It's not about fear, it's about awareness. You know your body better than anyone else. And when something doesn't feel right, that's your invitation to ask questions and get the peace of mind you deserve. Sign 3, persistent itching on the lower legs. When it's more than dry skin, after the scalp, another place that often sends early signals, quietly and persistently, is the lower legs, especially the shins and calves. For many older adults, itchy legs are brushed off as just dry skin, poor circulation, or even sensitivity to soaps or laundry detergents. And sometimes that's exactly what it is, but not always. When the itching becomes relentless, especially if there's no rash, no flaking, and no clear reason, and when lotions and creams don't seem to help, it may be time to consider that your body could be trying to speak to you in a deeper way. Persistent lower leg itching, especially in people over 60, has been linked in some cases to lymphoma, a cancer that affects the lymphatic system, which is part of your immune network. Lymphoma often starts subtly, with symptoms that are easy to miss: fatigue, night sweats, and yes, itching. But this itch is different. It tends to be deep, almost like it's coming from within the skin, not on the surface, and it often gets worse at night, disrupting sleep and lingering even after you've tried every soothing remedy you can think of. Let me tell you about Thomas, 76. He started feeling itchy on the front of his legs. No bumps, no dryness, just this nagging irritation he couldn't explain. He assumed it was his socks or maybe an allergy. But after a few months of no improvement and new symptoms like night sweats and feeling unusually tired, he finally went to his doctor. Blood tests showed abnormal white cell levels and scans revealed swollen lymph nodes. He was eventually diagnosed with early-stage non-Hodgkin's lymphoma. Looking back, he said, "That itch came first. I just didn't know it mattered." This isn't about assuming the worst every time your skin acts up. It's about knowing the difference between a common irritation and something more unusual. If your legs are itching with no rash, no new skin products, and the discomfort doesn't improve after a couple of weeks, it's time to ask your doctor to take a closer look. What makes this kind of itching unique is that the skin often appears totally normal, yet the sensation feels intense, even unrelenting. That's because it may be driven not by a surface issue, but by inflammatory chemicals released into the blood by abnormal immune activity. In other words, your skin isn't dry, it's being affected from the inside out. And here's something else to consider. Our nerves remain sensitive even when deeper tissues are affected. Sometimes the first sign that something's not right isn't pain or swelling. It's irritation in the nerves that live just beneath the skin. If you or someone you love has been applying creams every night, trying new soaps, wearing looser clothing, and still wondering why the itch won't stop, it may be more than a skin issue. Trust that inner nudge. Bring it up at your next checkup, because listening to these subtle cues before they grow louder is one of the smartest things you can do for your health and your peace of mind. Sign 4, itching on the chest or breast area. A signal many overlook. Now let's move to another sensitive area that often gets dismissed, the chest and breast area, especially in older adults. Whether you're male or female, a persistent itch in this region, around the nipple, beneath the breast, or across the chest, deserves a little more attention than we usually give it. Often we chalk it up to sweat, a tight-fitting shirt, maybe some friction from a bra strap, or just the natural effects of aging skin. And while those can certainly be true, when that itch keeps returning, always in the same spot, and refuses to respond to creams, powders, or even changes in clothing, it's worth taking seriously. Because in some cases, that kind of focused, persistent itch has been linked to inflammatory breast cancer or even lymphatic cancers near the chest wall. And here's what makes this so important. It often shows up before any noticeable lump, pain, or swelling does. This kind of cancer doesn't always follow the usual rules. Sometimes the skin looks slightly red or irritated. Other times it feels thicker, warmer, or just subtly different to the touch. But just as often, there's nothing to see at all, only that lingering, restless sensation that no lotion can touch. I'll never forget Marjorie, 68. She told me the area beneath her right breast had been itching for weeks. She figured it was her bra or maybe dry skin. She tried everything, new fabric, fragrance-free detergents, even going braless for a while. But the itch persisted. When she finally mentioned it at a checkup, her doctor noticed a very slight puckering in the skin, almost unnoticeable. A few tests later, she was diagnosed with an aggressive tumor growing just beneath the skin surface. Her early attention made all the difference in her treatment plan. It's not just women who need to pay attention. Men can develop breast cancer too, and it often goes unnoticed because we don't expect it. A small itchy patch near the nipple, a sense of pressure, or a skin change under the chest muscle can be quietly signaling something deeper. Many men ignore these signs until they become harder to ignore, and by then, they've lost valuable time. Another point to keep in mind, itching in this area can also be triggered by enlarged lymph nodes near the collarbone or under the arms, often tied to lymphatic cancers. So if the itching is paired with swelling, a feeling of heaviness, or warmth in the same region, don't wait it out. You don't have to panic, but you do need to pay attention, because sometimes cancer doesn't arrive with pain or a lump. It arrives with a whisper, a change in sensation, or a subtle skin message that asks to be heard. So if you've been treating the same itch again and again, and nothing's changed, bring it up. You're not overreacting, you're being proactive. And when it comes to your health, early awareness is one of the greatest gifts you can give yourself. Sign 5, persistent itching in the anal or genital area. When embarrassment delays answers from the chest, we now move to a place many people hesitate to talk about. But that might matter even more, the anal and genital area. Let's be honest, this is a deeply personal topic. And because of that, many older adults brush it off, thinking it's just part of aging, poor hygiene, or a temporary irritation. Maybe you've blamed the itch on dry toilet paper, a reaction to soap, sweat from summer heat, or even a side effect from medications or incontinence pads. And sometimes that's all it is. But when that itch keeps coming back, always in the same area, and especially when it doesn't respond to cleaning, creams, or lifestyle changes, it's time to stop whispering about it and start paying attention. Chronic itching in this part of the body, when unexplained, has been linked in some cases to anal, vulvar, or even penile cancer, particularly in people over 60. It's not common, but it's not unheard of either. And the danger isn't the symptom, it's the silence around it. Let me tell you about Eugene, 76. He dealt with what he thought were hemorrhoids for nearly a year. Itching, discomfort, irritation. He tried everything. Dietary changes, ointments, cool compresses. Nothing helped for long, but he was too embarrassed to bring it up at his appointments, until one day he did. A quick exam revealed a small lesion on his anal canal. It turned out to be an early-stage tumor. He later said, "I almost didn't say anything. I just didn't want to make a big deal out of it. But speaking up saved me." For women, especially postmenopausal women, vulvar cancer is rare but becomes more likely with age. The signs? A recurring itch on one side of the outer genital area. Often there's no lump, just a patch of skin that feels slightly different, thinner, rougher, or discolored. And again, the danger lies in how easily it's mistaken for dryness or hormone changes. What sets cancer-related itching apart is its persistence and resistance. It doesn't go away with moisturizers. It lingers despite hygiene. And it often feels deeper, a burning or rawness that isn't helped by anything over the counter. Here's the challenge. This area is packed with nerve endings, making it very sensitive and also very reactive to internal changes. Whether it's irritated tissue, shifting cells, or swollen nearby lymph nodes, the skin here often speaks up long before anything more obvious appears. So what should you do? First, don't be embarrassed. These are medical concerns, not moral ones. Write down what you're feeling. Track when it started. Describe whether it's getting worse at night, whether it stays in one spot, or if it's worsened over time. Then bring that journal to your doctor. Let them see the pattern, because sometimes the most awkward symptoms lead to the most important discoveries. And saying something, even just once, can help catch something early, when it's most treatable. Your body speaks in all kinds of ways, and when it sends the same signal over and over again, it's not complaining. It's asking for help. Let yourself listen. Let yourself be heard. And remember, being proactive isn't overreacting, it's self-respect. As we close today's video, I want to leave you with a gentle but powerful reminder. Your body is always speaking to you, sometimes quietly, sometimes persistently. An itch might seem small, it might feel like nothing, but when it lingers, when it settles in a specific place, and when nothing you try seems to help, it's no longer just a skin issue. It could be your body's way of asking for attention, long before pain or obvious symptoms appear. We explored 5 areas today: the upper back, the scalp, the lower legs, the chest or breast, and the anal or genital region. These aren't random spots. They are places where cancer has been known to send its first soft signals, often disguised as simple irritation. This video wasn't made to alarm you. It was created to equip you with knowledge, awareness, and the courage to act if something feels off. Because catching something early can change everything. So if any of these signs sounded familiar to you or reminded you of a loved one, don't ignore them. Talk to your doctor, ask questions, trust what your body is trying to say. And if you found this video helpful, please subscribe to Golden Minds, turn on the bell, and share this with someone who might need it. Your support helps us keep creating content that informs, empowers, and uplifts. Thank you for watching, and remember, when your body whispers, listen, because sometimes that whisper is the first step toward healing.